Good afternoon. We have with us Dr. Simas Bandyopadhyay, an expert in medicine rheumatology from the Apollo Multi-Specialty Hospital, Kolkata. And we welcome you to the Natco Pharma Specialty Studio this afternoon. Doctor, we look forward to talking to you at this moment for an advice to the younger generation of doctors, those who are associated with critical care, especially in bacterial resistance. My first question to you is what are the changes you have foreseen in critical care management?
Right. I, I joined the Indian Critical Care Society about 15 years back. And what has changed over time is extreme dependence on machine for forgetting the patient it's himself or herself. I think the new generation doctors need to keep this in mind that it is not only the HPO2 in the monitor, not only the ETCO2 on the monitor, but also the patient it's himself or herself, the total well-being of the patient, looking into the symphony of multiple organs. Because in critical care setting, often 3 or 4 organs are in jeopardy, and one has to have an understanding of the interrelations of the organs and thus modify the whatever the treatment is warranted for the patient. So a good understanding of medicine as such is extremely important on top of the specialist critical care skills. And I think that is what needs to be promoted and developed over time.
You've almost answered the second question, but I still want to go ahead and ask you that one message to the young ICU doctors for enhancing patient care.
I think understanding the physiology of the patient, of various organs, is very important. Uh, it's not a blame, but currently the medical curriculum is devised on multiple thought segments, which they call as semester. And once you've done a semester of one subject, it is done and dusted. But the overall physiology of a patient does not come in a fragmented form. So I think that is why the dependence on machine is increasing. Though I'm not against machine, but I think machines are there to help us, and AI-driven machines will be there to help us more. But at the end, we have to direct those machines, be it AI directed, be it non-AI directed. So, understanding of physiology of multiple organs in combination is what is needed for becoming a successful critical care specialist.
Love that advice you have shared. What is the prevalence of carbapenem producing bacteria in the practice today?
Is huge. Is more than 50% in any big hospital. Slightly less maybe in smaller settings. Uh, the corollary to that would be that many of the labs, they don't have the technology to find out carbapenem resistance. So they don't come out with AMC and those sort of values so that you know what is the actual resistance pattern. But it is huge burden.
And how do you look at the treatment options in such cases?
It's pretty difficult. It involves combination of multiple costly antibiotics depending on the sensitivity pattern of the local area. Local area sensitivity is very important, and that sensitivity and the bacterial isolate pattern tends to change from time to time. So what is prevalent for this 3 months or so, maybe in 6 months down the line will change and become another bacteria in the same hospital, same ICU setting. So the practicing doctors need to have good liaison with the microbiologist, and the microbiologist needs to actually teach these people about the local prevalence at that point of time and the appropriate sensitivities. I think that is where the key lies in targeting fast and targeting hard.
Dr. Bandyopadhyay, you have spoken your heart out, and we thank you so much for your time at the Natco Specialty Studio. We wish you all the best in your practice.